In this episode, we'll talk about a new therapeutic light source that is being hailed as a potential laser replacement.
The advantages of fat transfer for facial volume restoration.
How two new agents could change the treatment landscape for melanoma patients with b-raf mutant tumors.
And finally, contributing dermatologist Dr. Lily Talakub talks about the etiology of under-eye circles.
Welcome to our newscast. I'm Amy Pfeiffer.
And I'm Terry Rudd. Let's start with TRASERs. Israeli scientists have developed an investigational therapeutic light source with many wavelengths and a high peak power. Our reporter Doug Brunk interviewed Dr. Christopher Zachary about the device.
Dr. Zachary, what does TRASER stand for, and what role might this device play in aesthetic medicine in the future?
So the TRASER stands for Total Reflection Amplification of Spontaneous Emission of Radiation. Sounds a little bit like a laser, but it's not a laser and it's not an intense pulse light. It's one device that can put out many different wavelengths with many pulse widths. And the concept is that it could actually, in a relatively short time, replace 4 or 5 lasers that you might currently have in your clinic with just one device. And by simply changing the dye and the dye's concentration, you can change the wavelength and have this tremendous variation in pulse width and in energy.
Now, you said that this device is being created in Israel. Can you tell us a little bit about the development process, where it is in maybe phase 1 or phase 2 work?
So this has been designed by and is patented by Morgan Gustafsson. He actually was the individual who first came out with the patent for the intense pulse light. So he has a tremendous pedigree going back 20 years and more. And his design for this is such that it is a simple device. It is rather inexpensive to make. It has this tremendously variable pulse width and wavelength, but you can dial it in to the wavelength that you need. So you'll be able to replace, for instance, a KTP laser or a pulse dye laser or a ruby laser, either for treating blood vessels, port wine stains, doing hair removal, and so forth. And I suspect that this will be available sometime, shall we say, in the next 2 years on the commercial side.
We'll certainly continue to follow the development of this device. Now on to restoring facial volume. Dr. Lisa Donofrio discusses fat transfer and the advantages it has over off-the-shelf fillers, and why her patients prefer frozen fat over fresh. Reporter Doug Brunk has more.
I almost always use frozen fat. I rarely will use fresh, only fresh. In my hands, the most important thing is sequential fat transfers. So I tend to volumize over time. Maybe a typical case would be a total of 6 fat transfers over the course of 18 months or so. And I think that seems to be the key, is this slow, gradual augmentation, whether it's with frozen or fresh. It's difficult then certainly in that situation to get a patient to commit to 6 fresh fat transfers, since they would have to go through the harvesting or the liposuction every time. So part of what I'm observing is this re-fat transferring in the same patient. And I don't have a magic crystal ball, so I really don't know what's happening under the skin. I can just tell you that in my experience over the last 15 years with fat, most of it's been with frozen fat, and I see a definite trend towards very predictable longevity in those patients.
And you mentioned that of the 7,000 or so patients you've done, about 3/4 have been done with frozen fat, and that the patients come back specifically requesting that same process, so they're noticing some results too.
Yeah, about 5 years ago or so, the frozen fat came under such criticism when people started culturing previously frozen fat and looking at previously frozen stem cells and looking at viability as a parameter, that I felt the need, as somebody who wants to stay current of evidence-based medicine, to transition my practice over to only fresh fat. But the patients who had gotten frozen fat previously and had good longevity, say 10 years or so, were were more inclined to request frozen fat again rather than fresh fat. And for that brief period that I did try to transition out, I really didn't notice any increase in what I was seeing as longevity or maintenance of results than I did with using the sequential frozen fat.
Let's move on to a study from the American Society of Clinical Oncology's annual meeting. Phase 3 clinical trials have found that trametinib and dabrafenib interfere with signaling in the b-raf pathway and effectively reduce the risk of melanoma tumor progression and death. Reporter Susan London spoke with one of the investigators.
Can you compare dabrafenib with vemurafenib for us?
Yeah, that would be an unfair comparison because this is not a head-to-head trial. The drugs were not compared. But, since the trial design is almost identical with one major difference, this is a 3-to-1 randomization from dabrafenib to DTIC, and the other trial, the BRIM-3 trial from vemurafenib presented last year, was a 1-to-1 comparison. There were significantly higher patient numbers. So, but let's speculate. The results on the progression-free survival are almost the same. The results on the disease, on the response rate is almost the same, but we cannot provide overall survival because here the patients got a crossover. 68% of DTIC-treated patients got dabrafenib when they had a progressive disease, and therefore it will be difficult to speculate on the difference in overall survival. All the other parameters are almost the same. There is one difference, and this is toxicity. We reported for dabrafenib lower numbers of patients with epithelial skin cancer, like keratoacanthomas and squamous cell carcinomas, and lower numbers of patients with photosensitivity.
And we heard a little bit today about a MEK inhibitor as well. Can you briefly discuss the potential of combination therapy in this setting?
Yeah, so I found the data on the METRIC trial, which is investigating the MEK inhibitor trametinib to conventional chemotherapy, very interesting. And it shows response rate improvement, progression-free survival, and overall survival improvement. I mean, it's a great basis, and certainly the drug will lead to a new approval.
Researchers are saying that the next step for these drugs is using them in combination. It's really an exciting era for the treatment of metastatic melanoma. And now moving on, contributor Lily Telekub discusses a common patient complaint: under eye circles. Dr. Telekub, who practices in McLean, Virginia, breaks down their etiology and offers treatment options.
Patients often come in and ask us about under eye circles, and the treatments vary depending on the type of circles they have. I'm going to propose a classification system for under eye problems and propose treatments for each type. Under eye problems arise from genetic, environmental, and skin-related diseases. However, the treatment differs based on the etiology. The first problem is periorbital hyperpigmentation. It's darkening underneath the skin due to hereditary and genetic factors. Ethnic skin types have increased hyperpigmentation. However, rubbing of the eyes or eczema can also induce it. Treatment for this includes avoiding the rubbing, retinoic acid or alpha-hydroxy acid treatments that exfoliates the skin lightening creams such as azelaic acid, kojic acid, or hydroquinone, as well as Q-switch lasers or intense pulse light therapy. The second type of under eye problems are periorbital vascular prominence. This can occur both in young and old patients. It does not vary with age. Eye creams that contain caffeine can constrict the blood vessels and reduce the problem. However, they don't solve the problem. Blue veins under the eyes can be treated with lasers. ND-YAG lasers can alter the appearance of dark blue veins around the eyes. However, lasers can cause hyperpigmentation if used in dark skin without adequate cooling techniques. So seeing a dermatologist that actually uses this laser on dark skin is very, very important. The third type is periorbital edema, or what patients call puffiness. This also can occur in all ages. It is induced by seasonal allergies, sinus infections, excessive crying, or water retention, such as high blood pressure or high sodium diets. The treatments are varied for this problem. Allergy medications given by your primary care doctors or by the dermatologist, as well as over-the-counter allergy medications, can decrease puffiness. However, possible sinus infections can be the cause as well, so looking into the cause of the puffiness is very important. Sleeping on the back will help reduce the puffiness of the eyes. Stomach sleepers or side sleepers can have increased edema as fluid is retained under the thin eyelid tissue. Avoiding rubbing of the area, avoiding harsh irritants, harsh cleansers, wiping off makeup before sleep are pointers that we tell patients that can reduce the puffiness of the eyes, as irritation of the eye fold area can actually cause edema in that space. Chilled cucumber slices, peas, or ice packs can actually decrease edema by constricting the blood vessels. However, sudden appearance of edema under the eyes can actually point to both thyroid, cardiovascular, and kidney diseases. So oftentimes these patients I refer for a thorough physical and evaluation. The fourth cause of under eye problems are intraorbital troughs or tear troughs. The infraorbital troughs actually can make the eyes look sunken or depressed. This can be due to genetics or dramatic weight loss. A small amount of hyaluronic acid fillers put very close to the eye in the trough can actually improve the appearance of infraorbital tear troughs. However, this has to be done very, very gently, as high doses of hyaluronic acid in that area can actually make the eyes look puffy. The fifth cause of circles around the eyes are periorbital dynamic or static rhytids. These rhytids occur due to genetics, due to sun exposure, as well as due to the muscles of the periorbital skin. Fractional laser resurfacing can improve the appearance of periorbital rhytids, as well as neurotoxins placed around the orbital rim in about 3 to 4 month intervals. The final cause of circles around the eyes are infraorbital fat pads. These are fat pads that protrude under the eyes and can make the eyes look puffy as well. The most effective treatment for the fat pad protrusion, however, is a blepharoplasty. So I often refer these patients for blepharoplasties. Treatment of this area can be very tricky.
Well, that's it for us. Make sure to visit skinandallergynews.com for the latest dermatology news.
And we've got a free iPhone app. Search for Skin and Allergy News in the iTunes Store. Thanks for watching, and see you in September.